Hey, mental workers, have you asked yourself the question, can I diagnose? How do I diagnose? What do I need to do? If you've asked yourself any of these questions, then this is the episode for you, because today, along with my guest, we are going to unpack this question, and it will lead us down a pathway where we're talking about assessment and how to go about assessment, how to tell people a diagnosis, and what are some of the ways that we can learn to be competent in assessments. And today's guest is Nicole Young. Hi, Nicole.
Hi.
Nicole is an educational and developmental psychologist. She's working at a school with young people, and I am so delighted to have you here, Nicole.
Thank you. I'm happy to be here.
Fantastic. So, Nicole, this was an episode that we collaborated on together. You came to me and you're like, I think I want to do this episode. And I was like, great. And so I really just want to share with listeners first your experience with this topic. How come you came to us and you were like, I think the listeners need to know about diagnosis?
I guess it's an area that I'm passionate about, or that I've found passion in through my work as a psychologist. But I also was reflecting back on my time when I was starting out through my master's program and doing placement as a provisional psych and then as an early career psych. And I was working in a space that, required me to do some assessment and provide some diagnosis, and just thinking about the feelings and the fears that I had at that point in time, and assuming that lots of the listeners would be feeling the same things. And I know, that's been reflected in some of the early career psychs that I have been working with and had on placement with me. And so I think it's relevant and something that we should be talking about.
I agree, because when you think about it, it's like you're a provisional psych, you say fresh out of uni or you're still in uni, and then you're almost placed into this position of power where you are the one wielding the diagnosis, and this could change somebody's life, and it's quite scary, hey?
Absolutely. It's intimidating. And still sometimes, I think about it. If I overthink about it too much, it feels intimidating. And, for some of us, it feels like we're not doctors and we don't have that kind of expertise or power, but we do, and it's really important.
Yeah, it's kind of like, okay, so you're saying I just open up this book, the DSM-5, and then I look at these symptoms and okay, they've got 5 and now you've got depression. Okay. And it can feel quite scary. Like, what are the implications of that?
Yeah. And I think there's so much mixed information out there too. There's people that are pro assessment and diagnosis, and there's people that are quite anti it as well socially. And there's a bit of stigma associated with some diagnoses, or, preconceived stigma by psychologists and society, that it can feel scary.
Do you feel that diagnosis falls within a medical model of conceptualizing people, or do you see it a bit differently?
I think fundamentally it does. And so even when I think about it, there are some diagnoses that I feel more comfortable providing than others. I think that most of us as people will experience anxiety at some point in time, and we know that fundamentally through the way our brains work. But having an episode of anxiety doesn't mean that you have anxiety. But at what point does it mean that you have anxiety, and is that useful for some people? So I think there are some diagnoses that, if the client is going to feel validated by it, then sure, let's give them a diagnosis of anxiety. But there are others that I feel like can actually help understand a young person, particularly in my role as a school psych. So things like cognitive assessment or learning assessments, they help to understand how this person's learning, what their strengths are, what their challenges are. And it can be quite medical, but you can also take it as a holistic kind of approach and try to be, neuroaffirming, or bring in lots of different information about early experiences, trauma. All of those things are really important in understanding a young person and how they function. And that can be weaved into any sort of assessment that you're doing or reports. And then the most important part of assessment and diagnosis really is the recommendations and what do we do to support this young person. And so gathering really useful, detailed information can help tailor those recommendations.
So what I'm hearing is lots of benefits from doing assessment. So there is on one side of the scale people who are like, no, diagnosis puts people in a box, and then that confines them to that for the rest of their lives. And then at the other side of the scale, what I'm hearing for you is that there's lots of benefits, that young people can find this validating, that it can help explain their experiences, and that we can give them recommendations to help make their lives easier. Is that right? Or am I going too far?
No, absolutely. And I think, I can understand where the people are coming from that say, that's putting them in a box, and how dare we define someone just by a label or a title. But fundamentally, at the end of the day, I guess I am pro-diagnosis and pro-assessment, because I can see the benefits in myself, in my friends and family, but most importantly in the people that I've worked with.
Yeah, so maybe let's just unpack the benefits a bit more. Like, for example, let's say somebody is experiencing, well, they think they might be autistic, a young person. Let's say they're like 12 years old and it's come to their parents' attention as they've made their transition from primary school to high school that they might be having some challenges, and these might be reflective of autism. Maybe you could just share with us what would be the benefits of diagnosing this person as autistic?
Yeah, so that young person has probably come to that realization because they're experiencing some challenges in a neurotypical world that may not be supporting them. So whether that is socially, or, the classroom is really overstimulating from a sensory perspective, or they're struggling to keep up, or, they're getting in trouble because they're stimming or fidgeting, or, whatever it is. So there's probably some sort of challenge, and they might have done some Googling, as we all have, and come to you. And I think that the benefit for that young person can be, first and foremost, there's a reason, and it's not me. It's not that I just can't do something, or I'm stupid, or I'm different. And I think for teachers and parents too, it can give them some understanding. Often young people with neurodiverse presentations can be thought to be behaviourally challenging, or like they're choosing to act in this certain way, or they should have got it by now. And I think that's the reality from lots of teachers in that education setting. And having a diagnosis can actually change that kind of perception of a young person. So people are a bit more understanding. They can set up the environment to best suit them.
So what I'm hearing from you is that a young person might actually already be coming to you being like, I'm experiencing some challenges. I think I might be broken. Maybe there's something wrong with me. So maybe they've got all these negative thoughts about themselves and judgments. And by giving them a diagnosis, it's almost like we're saying, no, you're not broken. There's nothing wrong with you. Here's you. And here's how we can help you to thrive in this world, which is really set up for people who are not neurodivergent.
Absolutely. That's a really great explanation. I think it's that you're not broken, and actually this is how your brain works.
Yeah.
And whether it's autism or ADHD or just poor working memory, or, something, that actually teaching that young person that this is your strengths, these are your challenges, this is what we need to do to support you, can be really empowering.
Yeah, and I'm just curious, Nicole, because I reckon a lot of our listeners would be thinking, oh crap, but some people, they react really negatively to diagnoses. Maybe they will be angry at me if I give them a diagnosis. Maybe it will do them harm. Are there any cons to giving people diagnoses or assessing them?
Yes, there are some people that do feel like that. At the end of the day, as we touched on already, there's kind of that two sides of the coin. There's the people that are pro-diagnosis, and then the people that have a stigma associated with it. And, even thinking about who I've been working with recently, there is one parent who is really anti-assessment because they don't want to receive a diagnosis for their child because of their own experiences when they were younger and they received a diagnosis and felt like it impacted them negatively because they were categorized in a certain way. So that's, that parent's experience, and I want to validate that. And I think for them, it'll be a journey, and it may lead to assessment at some point, or it might not. And that's okay too. We're still going to support the young person, and we can support them as if they had a diagnosis, because that's what we're trying to do. We're trying to understand what their strengths and challenges are so that we can work with them, regardless of whether we give them a label or not. So I think, there are people that for whatever reason can feel like that. If I was to look back on most of my clients and my experiences in different settings, I would say, it's probably 90% that are happy with a diagnosis, are either coming looking for one, or throughout conversations, you kind of take them along on that journey and help them to understand, and they get to a point where it can be really validating and remove some of the confusion that they were probably experiencing before they came to you.
That's a really good point that some people and parents even might have had negative experiences. I'm just thinking dyslexia, for instance. I remember I've got people in my life who have a diagnosis of dyslexia, and a few decades ago, if a child received that diagnosis, they were pretty much labelled as stupid. And so that would be carried around with them for their whole educational lives. And so I can see the hesitance of some people around getting a diagnosis, primarily due to stigma and what that means to them. I really hope that it's changed nowadays, because what I see as the purpose of diagnosis, and correct me if I'm wrong, but I see it as a way to help the person understand their experiences, but also help us as clinicians lead them to evidence-based treatment and supports.
Absolutely. And, some conditions or diagnoses or labels or whatever we want to call them need some support and intervention. And others actually, we don't necessarily need to do anything, but it's a way of understanding and, okay, well, maybe we communicate this way, or, that, at a certain point, if we're thinking about social situations, maybe you go to a few and then that your cup's full and you kind of need to leave that. And having a diagnosis can help support that for that young person.
We're focusing a lot on young people because you work in school and this is your area. And it's probably a lot of your training, is that right? Like you've done a lot of your placements working with young people and assessing them?
Yeah, I would say so. I think, looking back during my training, even deciding which master's program to do, I knew I wanted to work with children and adolescents. So yes, most of my experiences in terms of placement and then all of my work in different settings has been with children and young people. The only adults I typically work with are parents, and it's about their child or young person.
The reason why I asked that was because I think the next thing I want to go to is how would I assess a person in front of me who comes to me requesting an assessment? And I just want to put this question to you, Nicole. So let's say you receive a referral in your inbox and it says, "Hi, Nicole, I'm a 40-year-old person and I am seeking a diagnosis for paranoid schizophrenia so I can use it in my court appearance next week. Can you please assess me?" What would be your response to this?
Well, that one I would say is outside my competency, and I would be referring to someone else. So I guess that touches on the importance of working within our competency.
Yeah, that's what I'm thinking. So it's like almost the first question that we need to ask ourselves. It sounds like, please correct me if I'm wrong.
Yes.
It sounds like the first question we need to ask ourselves is this within my scope of competence? Like, can I actually assess this person?
Yeah. So one, what are they asking?
Yes.
What information are they giving you because there are situations where people have Googled or someone's mentioned something to them or they're wanting funding or, there's some kind of reason. So we're asking ourselves, what are they asking for? Am I competent to deliver it? Have they given us any information to indicate that this actually might be relevant or useful, or is there evidence that this could be worth assessing? Because we don't need to just assess everyone for everything. And the first stage of assessment is gathering that information. And then from a time perspective, the example that you gave, not many psychologists would be able to do an assessment in a week or two. So do I have time to do this? Do I have capacity? Do I have access to the assessment tools? Do I have the supervision? There's lots of things that you need to be considering.
Like I just heard you rattle off like 15 questions there. And I'm thinking for an early career psychologist, what would be going through my head would be like crap. And I'd just be like, oh my gosh, how do I actually deal with this? And that's even before you get to the assessment. So I'm assuming that maybe a recommendation for listeners would be if you're unsure about whether you can take on a referral to then seek external help. So I don't want to say, my urge was to say go cry to your supervisor, but be a bit more composed. And
ask your supervisor some questions.
Yeah, ask your supervisor some questions.
Absolutely. And I guess it depends on where people are working. But, if they were working in a private practice, there's generally some systems and things set up to support that process. So it might be that the practice is known for working with different clients, but there would also be a system in how does assessment work. So it might be that the receptionist does an intake and then, or allocates it to a psychologist who does an intake session. Then we gather some information from other people involved, whether that's the client themselves, their family, schools, those types of things. And then we kind of go through that process of information gathering and assessment. So even, my role in a school, I'm the only psychologist here most of the time. Assessments and referrals and things come straight to me. But as soon as something comes in, I don't then book a time to meet with the student tomorrow. It's about following my system and my process around, well, how do I formulate this? What's my hypothesis? What information do I need? How do I go about that?
Maybe could we frame this around ADHD? Just because I know that a lot of people do seek ADHD diagnoses. Like they literally come and they were like, I want an ADHD diagnosis. So I'm just curious, let's say that somebody has come into your inbox and it's like, okay, I would like an assessment for ADHD. I'm thinking I meet these criteria and I'd like a diagnosis. How do we manage those expectations? Because the purpose of assessment is not to necessarily confirm what the person thinks. It's to do an assessment and see what's happening here. And it could be very well that it's not ADHD, it's something else. So how do you manage that with clients?
Yeah, I think if anyone comes to you wanting something, that's probably one of the first conversations that you would have with them around, okay, so you came here and, you're wanting an assessment for ADHD and you think that that's something that might help us to understand you or explain some of your experiences. You talk to them to try and gather some information about why, and then let them know what the process is so that, yes, ADHD is relevant and it's becoming a bit more popular lately. And for good reason, it's challenging and debilitating for lots of people, but not everyone that has some attention difficulties meets a diagnosis of ADHD. So kind of talking to them about what the criteria is, how we might gather that information, that challenges need to be present from a young age, that there's lots of steps involved. And then going through that process that, yes, if we were to do an assessment, it might come out as having ADHD, it might come out as having something else because actually there's a lot of overlap, or it might come out with just some strengths and challenges for you, but not a diagnosis. So always being upfront with people.
So letting them know about the possibilities up front is very important.
Yeah, I think so. And even on the other hand, I've had therapy clients come to me before for therapy around something. And very early on, I've thought, there might be something here, whether it's ADHD or autism or learning difficulties. And I think it's really important to kind of name that too. And that conversation can be difficult because they haven't come for assessment. But ethically, if we didn't name it up and then in 4 years' time, they saw someone else and, that person was to say, has anyone ever mentioned this before? They'd be like, oh, no. And I saw that psychologist, Nicole, and she didn't mention anything, so she must be terrible. Or, so I always think it's important to kind of name what I'm seeing or my observations or my thoughts or, what my hypotheses are, and naming it in that really frank way that, actually some of what you're saying or describing makes me think a little bit about this. I don't know if you've heard anything about that. I'm not saying that you have that diagnosis, but it might be something that we could look at a bit further in future to see if that's a way of understanding you.
With assessment, my understanding is that you go through what's called a differential diagnostic process. So you've got several hypotheses about what this could be after you assess the presentation. And with ADHD, it could be an anxiety disorder, it could be depression, it could be an adjustment disorder, it could be trauma. And so is it appropriate to share the client at that stage the other diagnoses you're considering?
I think it's probably more of a case-by-case basis. You don't want it to be too clinical. You don't want the client to come in and then you to get, as you said, get out your DSM and kind of sit them down and say, well, these are the other things that we need to consider and let's write out a table and we'll tick one box at a time.
Yeah.
Particularly if they haven't mentioned anything about depression or something like that, that could be quite uncomfortable for that person.
Yeah.
But I think as we go, it's probably more of a casual conversation around, there are lots of things that can look a bit like ADHD. So part of the assessment for us will be making sure that we're getting the best explanation for you. And if, as we're gathering information, there's evidence of something else coming to light, then I'll talk to you about that as we go.
Can you just speak to this? I'm really curious because I think it's unique to young people, but young people are maturing and they've got lots of changes. They've got hormones, physiological changes, brain changes. Their brains aren't even fully developed yet. There's stuff going on there. How do you rule out the normal maturational changes with young people from possible, diagnoses that might be happening? I feel like that would be a minefield for assessment in young people. Is that right?
Yeah, it's tricky. And I think, particularly for parents who don't necessarily see a lot of young people, so they might have experience with their child and only their child. And if it's their first child, they don't know what teenagehood is like. And, it's a whole can of worms.
Yeah.
There's a lot going on there. So that can be tricky. Whereas one of the benefits of, let's say, working in a school is that you can very easily compare that young person to others the same age as them and kind of be like, well, actually, everyone's rolling around on the ground in prep. And that doesn't mean that this person has ADHD. Or in secondary school, most people have moments where they're a bit moody or they're a bit reactive, and we're all human. So I think, coming back to what's normal can be really useful. And then as we keep coming back to that information gathering stage. So, it's really important for any diagnosis that some present or some symptoms have been present for a while and in multiple settings. Most diagnoses in the DSM stipulate that. So gathering that information from teachers, parents, the young person themselves, and comparing all the information before you jump into a diagnosis can be really important.
It sounds like you're such a detective, Nicole, because it's
yeah.
Yeah, is that how you think of yourself?
I think so. And I was actually talking to some friends the other day, and I was like, oh, if I wasn't a psychologist, I reckon I would love to be a detective.
It'd be so cool.
Yeah, just like solving crimes and stuff. They kind of joked and said that I wouldn't be very good with the blood and gore, but I don't know. I think I'd be all right.
I reckon you'd be really cool. And just because as you were saying that, it's like, how we need it over across multiple settings. That reminds me most of being a detective, because it's like if a child is, for example, having tantrums at school, but they're not having it at home, it's like you put your detective hat on, you're like, why? Why is this happening?
Yeah, I feel like when I'm doing an assessment, I would ask myself a why question, every 10 minutes. Why is this happening? What does that mean? What else could that be? What does it look like? And
so with conducting assessments, I guess let's just focus on ADHD in young people. How do you actually select your instruments? So ADHD has come up as a diagnosis over the past few years, and there are so many instruments. How do you actually get your head around it as an educational and developmental psychologist?
Yeah, it's a lot. Not the ones on TikTok. I've had quite a few young people come to me lately saying that I've watched some TikTok video and it told me to look at this dot and I had to look away, so that means I have ADHD. Not valid. I think it's really important to go back to the evidence. What is valid, what's reliable? And we know that there's some assessment tools that are and some that aren't. So first and foremost, that keeping up to date with new things that are coming out is important. So whether it's doing some professional development in assessment or in new assessments, talking in peer supervision with your individual supervisor, all of those types of things can be useful. And then I guess it's just what do you have access to? And when I talk to my supervisees, and even when I'm doing assessment, the data that comes from the assessment itself is useful and really interesting. But I think more than the data is the observations. So being able to observe the child or the adult or the young person in different settings, being able to pick up on their mannerisms, their actions. If it was a cognitive assessment and they were kind of trying to solve a puzzle, the actual answer of whether they solved the puzzle is useful, but actually how they did that can be just as useful. Did they do trial and error? Did they get it right, but they just took too long? Were they fidgeting in their chair? All of that information we can add to our pile and then put our detective hat on and kind of think about what does that all mean.
So integrating this information is a key part of assessing.
Absolutely. Yeah.
It sounds so difficult, Nicole. As you're talking about it, I'm like, wow, so they have to make sure they have the latest assessments and then also balance that with what they have access to, because we have an ethical obligation to not use assessments from like the 70s, 50 years ago, right?
Yeah, absolutely. And I guess the access is important because we don't all have access to everything. And so even, there's some online kind of questionnaires that you can get, but knowing that sometimes either because you don't have access or it's a bit of a complicated case or you're not sure, I do it and other people I'm sure do it as well, that you might refer out to someone else for a second opinion or to get more assessment because they have access to something that you don't and you think that would be useful in helping to understand this young person.
Even in the selection of instruments, you have to make sure that it's, for example, culturally sensitive to the person in front of you or can meet their cognitive capacity. Like if you suspect an intellectual disability, you'd then have to select an instrument that is sensitive to that and appropriate.
Yeah, absolutely. I think it's interesting hearing you talk about it because it does sound complicated, but in the day-to-day, it's kind of less complicated. You tend to have 6 or 7 things that you have access to that you use quite readily. That's your assessment bank. And if someone comes to you that's outside of that, or that you think actually this isn't from a language perspective or an intellectual perspective or an age perspective, this isn't valid for this person, then I would probably be looking to refer them to someone else. So you don't have to be the jack of all trades and be able to assess or fit something to everyone. It's kind of once you've developed your toolkit, obviously you're keeping yourself up to date with research and updating it as you need, but you don't have to have everything. That's a lot to be on top of, and financially and all of those things.
I really love that. And I think that's really important for our listeners to hear, that you don't have to be a jack of all trades. And in fact, it sounds like really, really stressful and probably financially stressful to actually be that.
Absolutely. Even if we were just to take cognitive assessments, the two main are the Wechsler and the Woodcock-Johnson. There are others out there too, but not many psychologists use both the Wechsler and the Woodcock-Johnson, because why would you? Or, even just trying to remember to be across different things and report writing and using different language when administrating it can be a bit complicated. So I think you kind of pick a lane and then stick to it.
Yeah, you sound really comfortable with knowing this is what I do, this is what I don't.
Yeah, I think so. And comfortable having that conversation with people. So, if they were coming to you wanting a specific assessment that they'd seen online, being able to say, actually, that's not something that I'm able to do or willing to do. This is what I can offer you, or let's work out a way that we can try and find someone who can give you that. It's interesting though, because for the most part, our clients, I don't think, know what assessment is.
Yeah, I agree.
They don't know what they're coming for. They don't know if you're going to get them to do a questionnaire or puzzles, or they have no idea. And
yeah, they've seen a dot on TikTok and they're like, she's got to make me follow the dot.
Yeah. And I had a young person, a child once, who was probably 5 or 6, and he came in and he was quite distraught. And I was like, what's going on? And I had a conversation with his mum, and then I might have asked him, and his mum had told him that he was coming to see me so I could work out how his brain worked. And in his mind, he thought I was going to chop open his head and look at his brain.
Oh, no.
So, he was quite upset.
Poor thing, of course.
Yeah. And I was like, oh, no, I'm not going to do that. We're going to have some fun. You get to play on this iPad.
Oh my God, poor thing. He thinks you got to get out a knife and cut up his brain. And he's like, she's just buttering me up with the games here.
Yeah. So it's really interesting what people's idea of assessment is, particularly if they have only ever seen a doctor before. A doctor might take your blood. I'm not going to take your blood.
Yeah, she wants to know how I solve this puzzle. What a weirdo.
Yeah. What do you mean? That was fun. That wasn't an assessment.
Yeah, I've often had that feedback from clients who I've done assessments with. They're like, no, I'm enjoying this. And I'm like, we might need to take a break from mental fatigue. And they're like, no.
Yeah, this is good, particularly with, children again and working in a school. I might take them out of a maths test and they get to come hang out with me, play with a fidget toy, do some puzzles, probably get a lolly. That's good.
I'm just imagining the other kids being like, Miss, I have ADHD too. Please assess me.
Yeah.
Contagion.
Absolutely.
I can't remember where we were up to back there, but I think we were talking about selection of instruments. And I guess just to be realistic about the training in these instruments, when I was going through uni and I did training in the waist and the whisk, it was really rigorous. What we had to do for one assessment was I had to train with a peer. They had to watch me do it. They had to mark me for every aspect of every subtest as to whether I did it correctly. And this would be quite specific. So, for example, for the memory component, it would be, did she leave a second between each digit? Was she chunking them? So it's very specific. And then I had to watch her and then also rate her, and then we'd get feedback overall and would have to practice. Does that reflect what your experience is with learning assessment instruments?
Absolutely. I remember the same at uni, and then getting to the point, I think I did one on my housemate at the time, and then sat down with one of the lecturers and had to administer a few assessments subtests with her, and I was so scared that I was going to say all the right things. And it's funny you mentioned the working memory one, because I vividly remember doing that subtest and looking at the clock and kind of counting the seconds to the point that I probably left too long between them. Even with supervisees now, it is a lot to think of, but the more you do it, the easier it gets. So, the phrases that you use now are second nature to me. When you have to do a query and a cognitive assessment, I know the 3 phrases that I can use, and they come naturally. And by having some of those skills as second nature, it means that you have capacity to be doing lots of those other observations that I talked about. So I know when I've worked with early career psychs as well, and I've suggested to them that, the behavioral observations are really important and make sure you're taking that down. They kind of feel like, oh my God, I have to do all of these things and I have to score this assessment and I have to take it down. Whereas when I'm doing an assessment now, I'm often keeping notes, I'm scoring the subtest as I go. I can do lots of different things at once because some of those skills are quite automatic.
That's amazing.
Yeah, like all things that comes with practice.
Yeah, that practice is really important to be realistic. Like, you're not going to pick this up within a week. So, for example, listeners, if your workplace is like, I need you to learn the whisk within a week, no, you're not going to do that.
Absolutely. And you don't have to. The person that you're assessing probably has never done it before. So they don't know what they're in for. They don't care if you make a mistake or you take your time when you're reading what you have to say, but also using the things to your advantage. So I guess for the listeners that, if you're looking at a whisk or a Wyatt, lots of the technology these days has practice tests set up. So you can be work through them with a peer, work through them with a colleague, and practice until you feel comfortable. Write yourself some notes, put sticky notes where you need to, do all of those things to help you. And then you'll find that the second or the third time you do it, actually, you don't need as many sticky notes and go through it that way.
Yeah, I love the technology-based assessments. I did a WACE using the Pearson iPads.
Yeah.
And it was a pain in the ass to set up. It's one of the main reasons I don't do assessments, because I don't want to deal with Pearson. I think that's really sad. But surely they're a thorn in your side as well.
Oh, I feel like I've got it set up now and it kind of works.
Amazing.
Yeah.
I'm very envious.
Yeah.
But that's fantastic. But listeners, if you need some assistance, then make sure you reach out to your supervisors. I think Nicole mentioned that she's got some supervision spaces as well.
Yeah, absolutely. I've got a couple of free spaces. So if anyone is looking particularly at just some assessment supervision or needing someone to kind of help formulate a case or those types of things, I'm more than happy.
Nicole, I just wanted to move on to giving feedback to clients, and as maybe this is a separate thing, but writing the report as well. This is one of the things that puts me off assessment as well. It's writing the report. I like being a detective, and I would love to be the person in the crime show walking around and being like, oh, there's a clue over there, but I hate writing it up. My goodness. But you must enjoy that.
Yeah, I do enjoy it. It
God.
can be a bit burdensome sometimes if you've got 3 or 4 that are kind of due. And I think just the nature of my current work is that finding a block of time to sit and do some admin can be difficult without an interruption. But I'm quite happy to, sit and write a report, have a coffee, get in the zone. And again, I think once you've got practice, lots of those phrases become a bit more automatic. I think
that's true. So you've probably got templates as well, right?
Yeah, templates, and there's a space. And anyway, I'll get off topic, but I think there's a space for what kind of technology we can be using to support psychologists with report writing, because it is laborious and it's time consuming, but it's useful for the client.
Yeah, I think one of the issues that early careers face with reports and assessment is that they're going to spend more time on writing up a report than, say, an experienced psychologist like yourself. So they might spend 10 hours, but then the practice will say to them, look, reasonably, we can't charge them 10 hours for this just because you're inexperienced. We need to charge them for 2 hours. Can you just speak to that for a bit?
Yeah, that's completely right. And it's unfair and it's hard. And it's something that I think most of us have experienced. And I guess you don't get the experience by not doing it. So you need to practice if that's an area that you're passionate about. But also I'd be asking, your supervisor or the clinic, or if you're thinking about going to work in different clinics, what resources do they have to support you? So while it might be that they don't pay for all of that time, do they have a template of recommendation banks that you can use? Do they have report templates? Will your supervisor check them? All of those types of questions that can help early career psychs with their report writing.
I think that's really important. Do you have the resources, or what resources do you have? And you want to be making sure, do they have these templates? Do they have textbook chapters available to you? Because I remember writing these reports in uni, and it took me hours and hours to really find these chapters, to look at them, to find all these resources. And so a practice could save you a lot of time and heartache by providing you with the support that's needed to at least not spend 20 billion hours on a report.
Absolutely. Even just, giving you some sample reports.
That's a great idea.
What's the expectation in this practice? How do you like them to be written? Because there's no Australian standards in report writing. Every person does them differently. So what does this clinic like? Or is there scope for you to develop your own? But then how do I do that when I've never seen a report before? So I think having some of those templates and things is really key.
I agree. And moving on to giving clients feedback, what's a feedback session like for you with clients? Like, are they generally happy? Is it hard? Is it difficult to explain? What's it like for you?
I think for the most part, they're good. There's definitely a few that you go into still and you're kind of bracing yourself or thinking, I don't know how this is going to go. But my rule of thumb is to, wherever possible, try and have no surprises. So I think that's in a feedback session or a meeting or, whatever it is. I don't want to just drop a bombshell and then kind of leave. So if I was giving a diagnosis of, let's say, ADHD, I would have been talking about that leading up to it so that, we're doing the assessment, this is what we're looking for. And then during the assessment, if I was to do a cognitive assessment with a young person, I show them the graph on the iPad of the, whisk and kind of say that this is what your brain was really good at. And some of these things it found a bit more difficult. And that might mean that, when mum asks you to go upstairs and get 6 things, you can only remember to do 2 of them or you get distracted or whatever it is. So, talking about it on the way there and with families and parents as well, so that there aren't too many surprises in the feedback session, I think is really important. You never want to get into a session where, you're giving a diagnosis and the family or the client or whoever it is didn't even know that that was an option. And then so you might start the feedback session by kind of saying, we were doing an assessment for ADHD, and we also talked about how ADHD can sometimes look like poor working memory or anxiety, or sometimes people have some symptoms and not enough. So today we'll be talking through the report and the assessment that we did that came out of that. And so then you might go through it. You might ask them, often I might say, do you have any questions, or what are your thoughts? What do you think the outcome is, or what do you want the outcome to be? And then you can kind of frame your feedback session based on their own expectations. And then I typically talk through the report often as we're going. And if there is going to be a diagnosis, it comes up quite early on in the discussion that, actually the results of all of this mean that you do have dyslexia or something like that. And I think particularly for perhaps some of the listeners, dropping that label might feel quite anxiety provoking. And, I remember some of the first ones, I think I probably just word vomited out, it's autism. And then I got calm and explained, well, what does this mean and where to from here? And most people are there for what support can we have, or what should we be doing? Or, is there anything that we need to be considering or anything different that could happen? And, most people want you to spend more time on the recommendation section of the report.
Yeah, so they want to know, well, what does this mean for us and what supports do we need? What would you recommend?
Absolutely. Is there anything different that we need to be doing? Sometimes, there's funding available, or that you do need to go and see a different practitioner for more assessment, or sometimes it's that actually this is a conversation to have with school, or this is something practical for home. And I think that's where, if you are writing a report, really tailoring those recommendations for that individual is key.
Not giving generic things that it's like, well, what's the point of this assessment if you're not going to help us and with specific supports?
Absolutely. And sometimes, you can read some recommendations and think, I'm already doing that, or it is so generic. So you really want it to be tailored.
Nicole, a question that comes up for me is, so you work at a school, and I'm aware that for different assessments, it's not recommended that psychologists continue with treatment. So I think for some forensic assessments, it's better for the psychologist to just be the assessor and then not continue treatment. I think because it's a conflict of interest, or maybe it's a dual relationship. And I'm just wondering how that works for you in schools, because I imagine you might see a young person, here's the diagnosis of ADHD, and then they might come back to you for counselling, or how do you deal with that?
Yeah. And I think it's working in schools, but also I work in a relatively regional area. So the nature of dual relationships exist anyway. And unfortunately, and that's probably quite universal at the moment, that it's hard to get access to psychologists in the community. So often it's kind of like you've done some assessment, and if there is something that you feel like needs to be worked on through a counselling kind of lens, is it ethical to say, but I can't do it, and you have to wait 6 months for someone else? So I think having that conversation with the person, using a detective hat, all of those things can be important. Most of the time, I probably do it. Sometimes it's just assessment, and actually then it's about supporting teachers or the parents, and you've given them the info and that's all they need. Sometimes there might be some therapy. It comes back to the person's role, because even the nature of my work in a school is that I can't see all students long term. So if it looked like it was going to be some long-term work, I would be looking to refer out, and I might do 1 or 2 sessions while they're waiting. So I can't give a clear answer on that.
No, it sounds very tricky. And I mean, that's how it is with all ethical things, particularly with dual relationships. They're not prohibited. You have to weigh up what is in the best interests of the client and what is my role and boundaries.
Absolutely. Yeah, and I think, trying to think back to some of I would say most of the people I assess don't go on to need additional work or from me. It's more, well, how do we support their environment to best support them, or how do we work with their teachers or their parents to best support them? Because actually, as we mentioned at the start, there's nothing wrong with this person. They're not broken, but we need to support the system around them.
So, Nicole, I think we're coming towards the end, but one thing I wanted to ask you was, is there something that you think that younger Nicole, when you think back to your early career stages, would have benefited from knowing that current Nicole knows now about diagnosis or assessment?
Don't be afraid to have hard conversations, I think would be important. The first few assessments and diagnoses I gave, I remember feeling very scared and uncomfortable about. But the more you have those conversations, the easier they get. And knowing that so many people actually find a diagnosis validating, and you can give that feedback in a really nice and calm way, can be important. What else? Getting experience. So you have to practice to gain the experience. Obviously, as we've been talking, some of the things I've mentioned probably to the listener sound like, oh my God, how would you get from where I am to where she is? And it just takes a little bit of time and a little bit of practice, and you'll get there. Asking for help. We already touched on being able to have some boundaries and say no if you don't feel like you're interested, or it's outside of your competency, or you're not comfortable, or you don't know.
Thank you, Nicole. I think those things are really important for early career psychologists to know, particularly the having difficult conversations. Don't be afraid, lean in, but as well, get practical experience. I think you mentioned this off air to me, that you need practical experience so you know how different presentations present. So it's like, if you're unsure about what's normal, if you have that clinical experience working with clients, you can actually be like, okay, this is generally how it presents.
Yeah, I would say so. And if you were starting out and you were thinking about maybe, assessment interests me, or that sounds interesting, getting that experience with different presentations is useful. So go and work with people with anxiety or dyslexia, or go into schools, or work with clients with autism. All of those things can help you to understand, and no two people are the same and no two diagnoses are the same, and all of those factors. But actually it can give you a little bit more information about, this is what it can look like in the real world, because it looks very different to how it reads in the DSM table. Yeah,
that's very true. Yeah, I always say that to clients when I think of ADHD criteria, that the diagnostic criteria was written with like little boys who throw chairs in mind. It can look very different in, for example, adult women.
Yes.
And I think that's really important. So thank you for raising that, Nicole. Nicole, is there anything else that we haven't given a voice to today that you think would be really important for listeners to know?
I don't think so. I think if anything, I'd love them to feel a little bit excited about assessment and diagnosis and being a detective in the psychology space, and knowing that, they can do it.
Yeah. No, I think you guys do a really cool job. I did think of becoming an ed dev psych myself, but then once I got the experience in writing reports, I was like, I hate this so much. So like if I could be the detective and then like palm off my reports to somebody else, I would totally do it. But I realized that that's a bulk of your work.
Yeah, it's a bit. And I'm lucky in the sense, at the moment, I'd say assessment probably takes up 30% of my role. And of that, some of it's the one-on-one assessment and the information gathering. And then there's a section of report writing, and I don't hate it. So it's not burdensome for me.
I think that's great.
Yeah. But I've also worked with psychs before that have written most of their reports through, voice to text because that works for them, and they'll dictate things. And there's so much technology and things. So how do we use that to our advantage?
Okay, listeners, don't be put off by me then. It sounds like there is value to be found and that it's really enjoyable for you and quite a rewarding and enriching area.
Absolutely. But yeah, know what you like and work to that.
Yeah.
It's not for everyone.
Thank you so much, Nicole, for coming on and speaking with us about diagnosis and assessment and really unpacking this topic. I think it's really valuable for our listeners. So we're very grateful.
No problem. It's been nice being here.
Great. Well, thank you so much, listeners, for listening, and catch you next time. Have a good one.